Hello and welcome to another edition of For the Record. I'm Sean Murphy. My guest today, a couple of doctors. We're going to talk about multiple sclerosis. We're going to talk about the big walks, the MS walks that are coming up, and learn a little bit. My first guest is a returning guest to the show. Dr. Derek Smith is a neurologist, and he's at Backus Hospital, and he is a returning guest, so welcome back to the show.
Thank you, Sean.
How's it been? What's been going on? Have you cured any diseases since we were on the show last?
Well, I'm focused on multiple sclerosis.
Right, okay.
We have made a lot of progress. New treatments have been approved since we last spoke.
That's awesome.
And not only are they new, I think they're a little better. And so I think for people with MS, I always say, if you're going to be diagnosed with MS, now is the best time.
Well, I always ask this of doctors, and it's sort of a casual and a layperson sense. Do you see, is progress being made? I always ask the question, do you see the light at the end of the tunnel? I usually save it for later on, but since you brought it up, I mean, progress is being made? You can actually see great results coming?
Progress is being made. There are still large unmet needs, basically for people who already have a lot of disability. We'd like to be able to reverse that. We haven't made as much progress on that as we'd like. But for people who are newly diagnosed, I think most of the time we're able to get their MS under control.
Can you give sort of a generic or a layperson's definition of what multiple sclerosis is as a disease?
So it's a disease that involves the immune system and the nervous system. We believe for most people that it starts in the immune system, and there's a mistake that's made sometime probably during childhood where the immune system learns to attack what is a normal nervous system protein. And it does that repeatedly over long periods of time, generally in small areas of the brain or the spinal cord. And because the brain and the spinal cord don't heal that well, that can lead to long-term disability.
And there are many different symptoms of it, isn't there, that you can describe? I mean, do you see it?
So our nervous system processes everything that we do, and all of the outputs come out of our nervous system. So almost any symptom you can imagine can be a symptom of MS. There are more common ones. Typically, people start with relapsing remitting multiple sclerosis, and the symptoms will come on over a period of hours and then resolve over a period of weeks to months. So I could start listing symptoms.
Yeah.
We'd go a long time.
The whole show just on that, right?
Right.
Now, is multiple sclerosis one of those diseases where if you have it, you can have a good day and then the next day be completely different? Is that how it works?
Most people with MS do report a lot of fluctuations day to day because their nervous system is already somewhat compromised. Things like energy level, whether or not they have a viral illness otherwise, has a big impact on how they're doing.
How is it diagnosed?
So historically, this is an interesting point. Historically, the old MS centers would diagnose it using something called the hot bathtub test.
Because so it's very non-medical, I guess, right?
People with MS tend to be temperature sensitive. And when they get hot, their symptoms come out. And so, in the old days, they would stick them in a bathtub. If they came out with their eyes crossed, they'd say, "I think you have MS." We used to do a lot of spinal taps also for people with MS. But in the last 20 years, we've really come to rely on MRI scans. And when Medicare approved MRI scans as a therapy as a diagnostic test for general use, they specifically mentioned multiple sclerosis as a reason. You can't pick it up on a CAT scan that well, but on an MRI scan you can.
What's the difference between those two? Because a lot of times people who aren't familiar with medical terms will think, well, those are those things that they take X-rays, things that are in the hospital. That's what they are, right?
Yeah. So
That's what I say they are.
Sometimes talk about it as a giant donut. So it's a tube that people are slid into. It takes about 20 minutes to collect an image. There's no radiation, but they are exposed to a magnetic field, which some people think may be beneficial.
Are those the things that people who might be a little claustrophobic might get a little nervous about?
It's a little loud,
yeah.
And people sometimes do feel a little tight in there. We can usually get them through it.
They have open MRIs now, though, right?
They do, and for the brain, I think those are reasonable to use. For the spinal cord, you don't get good enough images.
So you mentioned early on in the show about progress that's being made, advances, research. So does that mean there are more treatments and different types of treatment that are available for it these days?
Absolutely. We've got about a dozen FDA-approved therapies to treat the underlying illness. And more are coming. And so I think that it's really an area of dramatic success in medicine.
And and obviously you are hopeful. Specifically, what do you do on your daily rounds at the hospital?
So most of MS is managed as an outpatient now. We do still admit people to the hospital, but that's down by about 80% versus what it was historically. And that's mainly because the medicines have been effective at decreasing, especially severe relapses. So typically I'll see somebody in the office rather than the hospital now.
Okay. Well, that's a good thing, right?
It is. It's a very
Yeah.
good thing. And, say for somebody who's newly diagnosed, they may be coming in with some dizziness or some visual changes, maybe loss of function in one or two limbs. And we do some neurological exam. And between the story and the exam, it may raise a suspicion for multiple sclerosis. The next step is usually an MRI scan.
Is there anything genetic about multiple sclerosis?
There are genetic risks that account for a minority of the risk. We think more often than not, it's just being exposed to the wrong virus at the wrong time during childhood. Even in identical twins, if one gets MS, 2 out of 3 times the other one doesn't.
Is it a disease where the earlier it's discovered, the earlier treatment it happens? I mean, is that a good thing? Is that only going to make a patient's life that much more easy?
For a number of reasons, we think identifying MS early and treating it early makes a huge difference. The immune system has memory, and that's why we get vaccines, for example. And so the more relapses somebody has, the more likely it is for them to continue to have relapses. And the harder it is to convince the immune system to stop attacking the nervous system. Additionally, we don't think of brains being exactly like kidneys, but they kind of are. There's some reserve function there. So you can take out one kidney, it doesn't really matter. You can take out half of the other kidney, it doesn't really matter. It's that last half kidney that you really need. And what we've learned from doing MRI scans on people with MS is that they can have a lot of relapses and lesions on the MRI scan without losing a lot of function. So there's a neurologic reserve there. And if you catch it early, you preserve more of that neurologic reserve.
Obviously, the ultimate goal is to eventually find a cure. Now, realistically, what would be more of a short-term goal? Is there such a thing that could happen, like a vaccine for multiple sclerosis? Is that possible?
It's interesting, one of the early attempts to treat multiple sclerosis was by Dr. Salk, who developed the polio vaccine. And he tried to develop a vaccine for MS, and it actually went the other way. It actually caused a demyelinating illness. So there have been attempts to develop a vaccine. If it was caused by a virus that we could identify, then I think developing a vaccine would make sense. Pathologists have been looking for decades for a viral cause of MS, haven't been able to find it. And so without a definite cause, it's more difficult to do that.
Having a lot of doctors on the show and talking about all kinds of different diseases, I find it interesting that sometimes with research and the work that they do, they find that studying some other disease, whatever research they're doing in another field, disease-wise, sometimes that can be beneficial to you too. Whether it has something to do with the immune system together or something neurological or whatever, or sometimes what you're doing could be very not so advantageous for their work. It could be the opposite effect, but I find it all fascinating. Do you see that?
Absolutely, and there's a lot of serendipity involved. So a lot of the treatments that have turned out to be effective for MS were initially tried in other diseases, and maybe weren't so effective there, and then turned out to be quite effective for MS.
Well, I want to go back to what you were saying about how it's kind of an outpatient treatment situation now. Obviously, any patient would much prefer to be at the comfortable confines of a doctor's office as opposed to a hospital where they could really, their nerves could really get to them, and it's just not as a conducively relaxing environment as your office would be, right?
Absolutely, yeah. No, I think that it's sort of a testament to our success as a field that we're able to do this now.
I want to talk about your involvement with the Connecticut chapter of the National Multiple Sclerosis Society, since that's kind of what we're talking about today.
Yeah, absolutely. So the MS Society's been around for quite a few decades now and has really been an important funder and participant in MS research and provided funding and support to researchers that have created some of the theoretical basis that have allowed these new treatments to be developed. And the NIH a few years back, as they saw that we were becoming successful with treatment, pulled back some of their funding for MS research. And so the MS Society's become more important in continuing those efforts.
And I know that you aren't in it right now, but you're going to get involved in a lot of the MS walks eventually, I think. We're going to talk about that more in the second segment, but I know that you're interested in maybe getting involved.
Yeah, we've been involved with, I sponsor people that participate in the MS walks, and we've had teams, and we plan on doing it in the future.
Good, excellent. And there's a lot coming up, but we'll get into that in the next segment. As we wrap up our time here, do you want to give out a website for people to go and learn more?
Well, the MS Society website, which is nmss.org, is a great one, and I won't advertise my own.
What's next for you? What's going to happen for you now, personally?
So the MS patients keep me very busy. They have a lot of needs, and again, the MS Society is very helpful, especially in some of the more difficult cases in terms of social support. And
that's a good point. Yeah,
that keeps me going.
One question I forgot to ask you is like the makeup of as far as gender or age. I mean, how does that work out? Is
It's
it all ages?
predominantly a female disease, 2 to 3 times as common
Do we know
in
why?
women. We don't know exactly why. We know that female immune systems are a little different than male immune systems, and you could say the same thing about the nervous system.
Yeah, it's fascinating. Again, we could talk about this all day, and I know you're going to get back to work and get to working on this, but as we wrap it up, you're hopeful. You're hopeful for the future, right?
Absolutely. Given the progress we've already seen, I have to be optimistic.
Excellent. Dr. Derek Smith, neurologist, Bacchus Hospital in Norwich. Thanks for spending a few minutes with us. We greatly appreciate it.
Thank you, Sean.
And we will take a short break and come right back. I'm Sean Murphy. This is For the Record. Stay right there. Welcome back to For the Record. I'm Sean Murphy. My guest for this segment is Dr. Joseph Schroeder, PhD, Associate Professor of Psychology and Behavioral Neuroscience Program Director at Connecticut College of New London. Welcome to the show. This is your first time on the show, right?
Yes, thanks for having me.
Welcome to the show. Man, that is a lot to fit on one business card. I don't know how you do it. So you're a professor. You've been teaching at Connecticut College. We sort of got into it with your description there, but talk a little bit about the courses that you teach.
So it ranges everything from introduction to psychology to mid-level courses. Like this semester I'm teaching a course called Psychology of Sleep, and then I teach a variety of neuroscience courses like brain imaging and sensation and perception. And this semester I'm teaching neurobiology of disease.
What is that? Because I mean, we're talking about MS today. It kind of ties into it. So what's covered in that class?
So the class is primarily for students who are interested in a career in one of the medical arts. So a lot of them are going to medical school, and in this course we touch on a different disease or disorder of the nervous system every week, and we talk about what causes it, what goes wrong in the brain, how is it treated, what's on the horizon for treatment strategies. And so it gives them a little bit of a flavor about what they'll be studying when they advance in their careers.
Now, from your point of view as a teacher, but you're in the field, progress being made toward these diseases and MS in particular, how do you see it?
Well, of course, they're making progress every day, and I think with the training of more talented students and courses like mine that kind of get them thinking before they even get into their advanced degrees, I think is one way of training the best people to find answers to some of these problems.
It's all about their creativity and their ability to think maybe outside the box a little bit about different directions to go, because obviously there's all the research, but we're not there yet, so you have to try something new, something else,
Yeah,
right? Something different.
And I think that happens probably more so in young people who are not so ingrained in one way of thinking according to what has been published in the literature, and they do kind of think outside the box.
Is there something that we're reading in the literature that we're sort of being led down a path that may not necessarily be accurate, or maybe are our hopes getting too high, or what's the deal?
Well, as in any scientific field, you build on what has been discovered previously, but oftentimes that kind of gets stagnant and doesn't advance as quickly as we might think. And it takes someone to think outside the box, and it's oftentimes those creative discoveries that lead to something that's pretty significant.
So you teach them, I mean, you're getting them going on the basics and stuff, but you know that all these kids that are in your class have that sort of creative mind, and you know they're going to take it to the next level, and who knows what can happen.
We like to think that, yeah.
Yeah. I was fascinated listening to you, even off the air, in the green room a little while, talking about things that are going on. You were talking about Michael J. Fox because he's certainly a celebrity, one of the bigger celebrities that's well known to be afflicted, and the progress that's being made with some of the treatments, I guess, and some in the sort of the experimental stage, I guess, a bit.
Yeah. So Michael J. Fox, of course, has Parkinson's disease. That's what we'll be talking about today in my class, and I was talking specifically about a visitor we're having in our class that is a young person who suffers from Parkinson's disease and has a surgical procedure known as deep brain stimulation, which helps dramatically with the symptoms, and it's just one of the advances that has helped quite a number of people in the last several years. So one of the things I try to do in my course is to quote unquote put a face on the disease, and so we get the students kind of outside their comfort zone with their textbook in their classroom and have them interact with people who are dealing with these individual disorders that we're talking about, or people who are caring for them. And that's why we also like to do things like benefit walks and fundraisers that benefit the organizations that are oriented towards helping them.
And that's sort of a way that you offer a little extra credit to your students, correct? Talk about that a little bit.
Yeah, so not just in this course, but in some of the other courses I teach, we organize teams from the college for the Walk to End Alzheimer's and the Walk Now for Autism Speaks, and in a couple of weeks we'll be participating in the MS Walk. And I want the students to get involved and interact with the people that are are involved in these organizations. But one way to try to get them motivated is I'll offer them 5 bonus points on their next exam or 10 bonus points just to show up, just to participate. And if they raise money on top of that, then that's a bonus. But
how can you say no to that? How can you say no to extra points by simply showing up? And they're not going to simply show up. They're going to participate in some way.
Right.
How could any student possibly say no to that? Easy points.
Well, it's worked so far.
Yeah.
Yes. And so for the
what do I have to do to bump up a grade, a whole grade?
That's,
what do I do?
that's what motivates students.
Yeah.
And, for the Walk to End Alzheimer's, we had 120 kids that showed up, and we raised several $1,000s for that organization, for the autism.
Does it grow each
Alzheimer's
time you do it?
organization.
Each time you get the kids involved, do you see a growing momentum of
Yeah,
participation?
we've grown steadily each year we've done this. This is the first year we're doing the MS Walk, so we hope to continue that beyond this year. But our teams have steadily grown in number and in dollars that we raised. But it also depends on which course I'm teaching. If I have a 40-student course, then my team automatically gets bigger.
Yeah, and that means more participation, though, if everybody wants to get involved
Right.
in it. If anyone wants to grab easy points, right?
Yeah.
Talk to me, like, sort of in layman's terms about how, like, Parkinson's and autism and MS, how it all ties together. Obviously, it's all neurological, right?
Right. Yeah. So as a neuroscience professor, that we try to give students kind of a general background in not only the anatomy and physiology of the brain, but then what happens when it goes wrong and how does that affect behavior. And so we're just kind of touching the surface on some of these diseases and disorders, and hopefully sparking their interest to pursue that as a graduate student or a medical student, and make a career out of it to try to help people that are afflicted with some of these diseases.
Can someone get real specific with what they want to focus and target on as far as what they will do with their career? Can they target one disease, or does it kind of neurologically all tie together? Can they get real specific about it?
So like I said, in this course, we kind of just touch on the surface, but we do have some upper level students who are doing research in the laboratory with some animal models or analyzing tissue. and they do get pretty specific. So we have models of schizophrenia or Parkinson's disease that they can test specific questions if they're talented enough.
Is it a field that you find students that want to be involved with? Is it a growing field as far as participation goes, or do you need more students to want to be involved in this?
Well, I have all the students I can handle right now. We're
For you personally, right?
We're the fastest growing major at the college right now, and I think that's probably reflective of the importance of neurological diseases in society and the burden that they have on society. It's a good kind of foundation for students who are going to be physicians or nurses or physician assistants or physical therapists, that if they major in behavioral neuroscience, then that gives them a solid foundation to move on.
Is it a promising field? Can they get into it knowing that they will have a career out there?
Yeah, so all of the STEM fields, the
Yeah.
science, technology, engineering, mathematics fields are expanding right now, and specifically neuroscience. There's a lot of need for therapists and technicians, but also basic science researchers and physicians who are going to have to deal with an aging population, which a lot of these disorders are.
Right. They afflict them most of all. Right?
Many of them are neurodegenerative that show up in older people. So as the population ages, we're going to be facing them more and more.
I always find it fascinating the makeup of the class. Are there a lot more women these days that want to participate and pursue that field?
That's true. Yeah,
Yeah.
we have it's probably 2/3 to 3/4 women in the neuroscience major that we have.
Excellent. Let's take one more break and come right back. I'm Sean Murphy. This is For the Record. We've got a little bit more to get to, so we will stay right there. So that is our show for today. I wanted to mention the very first walk that's coming up is going to be Saturday the 16th in Fairfield County. Right after that, Sunday in Waterford, Connecticut, which is close to you, close to us. April 17th is the next walk, right? And you're going to be participating in a lot of the local ones?
Yeah, that's at Camp Harkness.
Camp Harkness, all right. A website for people to go and learn more. It could be your website, it could be the college website, MS website.
I think the best way to, if you want to get involved with the walk, is to go to the Multiple Sclerosis Society website, which has links to the individual walks in your area.
All right, we'll put a graphic up on the screen for that. We learned a lot today. We could probably do a whole other show on this, but thanks for spending some time. I know you're getting back to class now, right?
Yeah.
Dr. Joseph Schroeder, PhD, Associate Professor of Psychology and Behavioral Neuroscience Program Director at Connecticut College. That is our show for today. You can see this show and many others on our YouTube site. Till next time, I'm Sean Murphy. This is For the Record. Take care.